Hello, Professor and class. I am Shana Mayer, and I am going to be presenting the adaptation model of nursing and how we can apply it in advanced practice nursing practice to educate patients on CAD, or also known as coronary artery disease. Sister Calista Roy is the one that developed the adaptation model of nursing. She was a professor, an author, a nursing theorist, and she also held a master's degree in pediatric nursing. As a peds nurse, this would help further explain her passion for developing the adaptation model. If you have children, you know not all children learn the same or at the same pace. This is probably what sparked her theory with the adaptation model. And then with CAD, or coronary artery disease, this is one of the leading causes of death in America today. And in this presentation, we are going to discuss how we can use the adaptation model to educate our patients about coronary artery disease. What is the adaptation model, and when was the adaptation model developed? The adaptation model is a model commonly used in nursing that uses a holistic approach in caring for the patient. So for example, instead of jumping right to medication for treatment, it looks at the patient's environment, seeing what can be added or subtracted to bring a healthy way of life to help heal the patient. Since the adaptation model is derived from holistic care, the activities of the advanced practice nurse move from being service-centered to serving in such a way that focuses solely on the patient. And then the adaptation model was developed by Sister Calista Roy, which I already said, in 1976, so pretty recent. What is the goal of Roy's model? Well, it is to assist in the adaptation of the patient during illness and health. Ursabis, Carriert, and Jaservi stated that the purpose of nursing is to help the patient adapt. If we assist in helping them adapt to a new lifestyle, they are more likely to be compliant with their care, thus increasing their life expectancy. And with the adaptation model, there are 4 modes. The first is physiological. The physiological mode deals with your basic human needs: food, air, and water. We have to evaluate if the patient is getting the adequate amount of each of these to be healthy. Next is self-concept. This is how a person perceives themselves personally and or physically. I would say the easiest way to describe this is how a person takes the news of their new illness and how determined they are to fix it. So for example, if they say, "I'm too far gone," they're not taking their news well. Or if they say, "If I lose 20 pounds, this could be life-changing," they're willing to adapt to the news that they got about their illness. The third mode is role function. This is how people conform to the different role changes throughout their lives. Losing a job, having to work multiple jobs, the stress at home or at work. How do they deal with the different stressors of everyday life? And then lastly is interdependence. This is a person's relationship with others. This includes their interactions with you and the rest of their healthcare team. If they don't have trust in you, they aren't going to be compliant with care. We're going to talk about coronary artery disease next. It is one of the most common types of heart disease in the world, making it a major concern in advanced practice nursing. Coronary artery disease is caused by plaque buildup in the arteries. This is also known as atherosclerosis. Around 650,000 people die every year from this heart disease, meaning it is the leading cause, making it the leading cause. It is estimated that 1 in every 13 Americans aged 18 years or older have coronary artery disease. Coronary artery disease gets worse with age, thus most older adults that have this disease eventually pass from this disease. We have the ability to teach our patients about the illness and about risk modifications to help them live a longer, happier, healthier life. We will be able to use the adaptation model to educate our patients about coronary artery disease because, as with most illnesses, self-care is one of the best things we can do to help prevent and maintain our health and illness. Self-care is a holistic approach, and most people make decisions based on familiarity. If we help our patients gain the confidence and skills in battling their illness, we have set them up for success. The heart is one of the most complex organs, and there are so many illnesses associated with it that it makes it super hard to understand. We can live without a gallbladder, we can live without a spleen, we can live with half of a liver, and we can survive with only one kidney, but we cannot survive without a heart. By using the adaptation model, I will be able to determine exactly how my patient learns, and then we can develop a plan to educate in accordance to how they interpret the material, thus leading to a better compliance and a longer life expectancy. How do we take this theory and put it into practice? Well, we have to establish what the patient knows and then manipulate their environment to further advance their learning. The patient has to be willing to make the changes. If the patient is not willing to make any necessary changes, we must find out why and then try to figure out ways to incorporate healthier habits. This could be finding them healthy snacks, going on walks a few times a week, and the walks could be short, could be a 1 mile walk, could be a 5 mile walk. It could be cutting down or cutting all salt out of their diet, those kinds of things. The more assistance we get from the patient, the better outcomes we will produce. With that, we have learned lots in this presentation. We learned what the adaptation model is, who developed it, and what the goal of the model is. It's the most common model used in nursing that uses a holistic approach, and it was developed by Sister Callista Roy in 1976. This model is relevant in all nurse practitioner practices. It can be used across the board. And then coronary artery disease is one of the most common heart diseases. It can be hereditary, and we can use the adaptation model to help educate patients on how to prevent and or treat their disease. Self-care is imperative to a person's well-being, and manipulating the patient's environment to their specific needs is the most effective way to educate the patient on how to treat their disease. I hope that was very informative for everyone. It was a great class. Thank you.